Lomaira, also known as phentermine, is used as part of a doctor-approved program for weight loss. It is meant for certain overweight individuals, including those who are obese or have weight-related medical issues. Losing weight can help reduce the health risks associated with obesity, such as heart disease, diabetes, and high blood pressure. It is not fully understood how Lomaira helps with weight loss, but it may work by reducing appetite, increasing energy expenditure, or affecting certain parts of the brain. This medication is classified as an appetite suppressant and belongs to a group of drugs called sympathomimetic amines. The recommended dosage for Lomaira is usually taken once a day, either before breakfast or 1 to 2 hours after breakfast. It is important to follow the doctor's instructions and the medication label for the best results. As always, consult your healthcare provider for personalized advice and guidance on using this medication. When taking Lomaira, it is important to follow your doctor's instructions. Typically, it is taken once a day, either 1 hour before breakfast or 1 to 2 hours after breakfast. Your doctor may adjust your dose to take a small dose up to 3 times a day if needed. Taking this medication late in the day may cause trouble sleeping. If you are using sustained-release capsules, the dose is usually taken once a day before breakfast or at least 10 to 14 hours before bedtime. Swallow the medication whole. Do not crush or chew sustained-release capsules, as this can increase the risk of side effects. If you are using the tablets made to dissolve in the mouth, the dose is usually taken once a day in the morning, with or without food. Place your dose on top of the tongue until it dissolves, then swallow it with or without water. The dosage and length of treatment are based on your medical condition and response to treatment. Your doctor will adjust the dose to find the best dose for you. To get the most benefit, take this medication regularly, exactly as prescribed, and for as long as directed by your doctor. Take it at the same times each day to help you remember. If you suddenly stop using this medication, you may have withdrawal symptoms. Your doctor may lower your dose slowly to help prevent withdrawal. Tell your doctor or pharmacist right away if you have withdrawal symptoms. Though it helps many people, this medication may sometimes cause addiction. Do not increase your dose, take it more often, or use it for a longer time than prescribed. Properly stop the medication when directed by your doctor. This medication may stop working well after you have been taking it for a few weeks. Talk with your doctor if this medication stops working well. Do not increase the dose unless directed by your doctor. Your doctor may direct you to stop taking this medication. Some common side effects of Lomaira may include dizziness, dry mouth, difficulty sleeping, irritability, nausea, vomiting, diarrhea, or constipation. However, many people using this medication do not have serious side effects. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Lomaira may also raise your blood pressure, so be sure to check it regularly and inform your doctor if the results are high. If you experience serious side effects such as fast or irregular heartbeat, mental or mood changes, uncontrolled muscle movements, or changes in sexual ability or interest, it's important to contact your doctor right away. Additionally, if you experience symptoms such as severe headache, trouble speaking, weakness on one side of the body, or vision changes, stop taking the medication and seek medical help immediately. Lomaira may rarely cause serious lung or heart problems, especially with prolonged use or when used with other appetite suppressant drugs. If you experience symptoms such as chest pain, difficulty breathing with exercise, fainting, or swelling of the legs, ankles, or feet, it's important to seek medical help right away. In the case of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. Before taking Lomaira, it's important to talk to your doctor or pharmacist if you have any allergies, especially to sympathomimetic amines, or if you have certain medical conditions such as diabetes, high blood pressure, glaucoma, heart disease, mental/mood problems, or seizures. Lomaira may cause dizziness, blurred vision, or drowsiness, so make sure to avoid alcohol or marijuana while using this medication. It's also important to monitor your blood sugar if you have diabetes and to talk to your doctor before having surgery. If you are pregnant or breastfeeding, Lomaira should not be used as it may harm the unborn baby or have undesirable effects on a nursing infant. Always consult your doctor before using this medication if you are pregnant or breastfeeding. When taking Lomaira, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's crucial to inform your doctor or pharmacist if you have taken other appetite suppressant drugs in the past year, as serious interactions may occur. Additionally, taking MAO inhibitors with this medication can cause a serious and possibly fatal drug interaction. Avoid taking MAO inhibitors during treatment with this medication, and most MAO inhibitors should not be taken for 2 weeks before treatment with this medication. Always consult your doctor about when to start or stop taking this medication. Lomaira may also interact with other medications such as high blood pressure medicine, phenothiazines, other stimulants, opioid pain or cough relievers, alcohol, marijuana, muscle relaxants, antihistamines, and products containing ingredients that could raise your heart rate or blood pressure. It's important to check the labels on all your medicines and ask your pharmacist about using those products safely. Furthermore, caffeine can increase the side effects of Lomaira, so it's best to avoid consuming large amounts of beverages containing caffeine or eating large amounts of chocolate while taking this medication. Lastly, this medication may interfere with certain medical/lab tests, potentially causing false results, so it's important to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much Lomaira and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. Symptoms of an overdose may include rapid breathing, unusual restlessness, fast/slow/irregular heartbeat, chest pain, hallucinations, seizures, or loss of consciousness. Narration: it's important to remember that using Lomaira alone is not a substitute for a healthy diet and exercise. For the best results, it should be used as part of a doctor-approved diet and exercise program. Remember not to share this medication with others, as it is illegal to do so. While taking Lomaira, be sure to attend any necessary medical and lab tests, such as blood pressure, heart, and kidney tests. It's crucial to keep all medical and lab appointments and consult your doctor for more details. The recommended daily dosage of Lomaira is determined by your doctor, and it's important to take it at the same time each day to achieve the best results. If you forget to take a dose of Lomaira, take it as soon as you remember. However, if it's close to the time for your next dose or late in the evening, it's best to just skip the missed dose. Don't try to make up for the missed dose by taking double the amount. Just take your next dose at the regular time. Make sure to store Lomaira at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of Lomaira, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Make sure to properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.